we learned of this last night around 9 p.m. or 10 p.m. And we immediately started coordinating, no, trying to contact the IHR focal point person of Hong Kong through our IHR system also. Unfortunately, we have not been receiving the response. So what we did this morning was to call the WHO country office, and they committed to help us. But of course, we were really in a hurry, or we wanted immediate answers. So we called on the Western Pacific Regional Office, no, and through this, they were able to give us a contact number, a direct line that we can call the Ministry of Health of the Hong Kong government. So we are now trying to call directly so that we can get further details. But in parallel, what we did was to, last night, we already requested from the Bureau of Quarantine the flight manifest of this PR300, the flight that was identified. And we received it this morning. We were able to look at the line list of passengers. There was a total of 40 passengers in that flight. And based from the profile that we have right now existing, no, na currently nahawak natin, a 30-year-old female. And we still don't know the nationality because even in the press conference of the Hong Kong authorities, hindi nila naman sinabi na Pilipino talaga. They just said that it came from Manila. So the line list of passengers, we have 40. We were able to zero in on two individuals with a profile of 30 years old female. So may dalawa tayo, and we were able to get the contact address, the contact numbers and all. Unfortunately, both contact numbers cannot be, hindi na po sila sumasagot, patay ang telepono. So ito pong contact address ay tinatawagan na ho natin ang mga pamilya. Also, aside from these two individuals, we also are doing contact tracing na rin dito sa additional 38. No? So we have 40. We just zeroed in initially dun sa dalawa, and now the other 38 passengers, nagko-contact trace na rin po kami dito. Kinuha na namin lahat ng contacts and addresses so that we can be able to do this. We already were able to inform our regional offices as well as to these different individuals na kasama dito sa PR300. So yun lang po ang maibibigay natin sa ngayon. We will be informing the public, no, and of course our partners in media kung meron na ho tayong makuha ng complete details coming from the government ng Hong Kong. Laura?
Thank you, Yusek. Meron lang po ditong question siguro kay Dr. Saloma. If because of our strengthened genomic surveillance, are we going to be testing more samples now just to check if this variant has indeed reached the Philippine shores?
In coordination po ng ating mga ports at saka mga resus, nais po sana namin na magbabatch sampling or magbabatch sequencing in batches of 768 more or less, because that will turn out to be cheaper individually at saka isang processing na lang. Kaya sa mga yung mga nakapasok sa criteria for the biosurveillance, makipag-ugnay po sila sa ating mga resus for the transport of the materials dito sa Philippine Genome Center, at saka ang ating DOH naman po ay nagpalabas naman ng mga guidelines. So expect po ninyo na mas marami pa tayong gagawin.
Thank you po, Dr. Saloma. So we're just checking kung ano pa po yung mga remaining questions considering comprehensive na yung nabanggit na update, no? So
Laura,
ito po from
Bons Mangsambol, nasa chat box.
Go ahead po.
Oo, because the Philippine Airlines daw was saying that those who, the individual who tested positive sa Hong Kong had a negative result prior to departure. Yes, we have that information, Bons. Itong dalawang sinasabi natin na nag-zero in tayo, na dalawang may profile na 30 years old female, were both tested prior to their departure, no, to Hong Kong. One was tested on December 20, the other one was tested on December 22, and both had negative results.
And then, as to whether nakuha niya sa Hong Kong, it really depends on the timing. Kasi ganito lang yan eh. Kung may negative siyang test noong December 22, it takes usually 3 to 5 days before they become positive again. So, if nakuha niya sa Hong Kong and nag-test siya sa Hong Kong after December 27, then it's more likely na doon niya nakuha yon, because we know that there are already cases of the UK variant in Hong Kong. We don't know. We need all this data. Otherwise, it's all just speculation. Kasi it might be just na, okay, nag-positive siya sa Hong Kong. Maybe they tested her in January. Pero because relevant yung travel history, nasama yung sa Philippines. And again, going back to that issue, nangyari rin yan dati, yung sa Taiwan, di ba, na hindi natin alam kung doon nag-incubate or dito. It's gonna be very difficult to tease that out. But the bottom line is, the action point is, we probably should at least act like there is a possibility this year so that we take double care talaga so that we don't have a spike over.